Hi guys, this is Mrs. Hall here with your unit on opening a sterile tray and maintaining a sterile field. According to infection control today, there are several choices in maintaining sterility of surgical instruments, including rigid containers, peel pouches of plastic and/or paper, and sterilization wraps. While in most international hospitals you would see commercially wrapped packages, the most commonly used method of sterilization is wraps. The multiple layers provide an excellent protection from microbial contamination. So this means that every tray has two layers. One that is kind of like the packaging and the other that is the sterile enclosed package. These are sealed with a steam indicator tape, which looks like a paper tape with a series of black diagonal lines. This actually indicates that the package has passed through the sterilization process. Studies in the 1970s indicate that microorganisms were found to penetrate single wrap muslin as early as 3 days and double wrap muslin in 21 to 28 days when stored in open shells. However, in 1984, an article by Mayworm rebutted this by saying that as long as care was taken with the sterilization, handling, and storage, any double-layered package will remain sterile unless damaged. Now, in Belize, we use the rule of thumb of 1 month as a viability for sterilization. I believe that this is mainly because of storage and handling capabilities for our institutions. This, along with the shortage in stainless steel equipment, leads to having a monitored number of trays on each ward so that turnover can take place. So it is imperative that you only use sterile trays when they are indicated and make every effort to maintain sterility throughout your procedure to avoid waste of resources. Before opening your tray, you have to check the package for any damage or soilage that may have compromised the package. As mentioned before, check the date. Note the steam indicator tape to confirm that the package has passed through the process and is viable for use. You open the tray starting with the flap being moved away from you. Then handle the right flap with the right hand and the left flap with the left hand. Do not reach across your tray. Colleagues typically work together at the start of the procedure to ensure that a minimum number of gloves are used to open the package as well. When you open your first layer of the package, you can open and throw out all other sterile equipment, then don sterile gloves to open the inner package, organize, pour fluids, and re-glove to start your procedure. Or you can don glove after opening your first layer, open your second layer, set up your tray to receive everything else, and then you re-glove after getting all your other sterile equipment tossed out and the solution poured. Be careful when opening packages and maintaining sterile and clean hand. Sterile objects become unsterile when touched by an unsterile object. When pouring your solution, try to pour just the amount of solution you will need for your procedure to preserve resources and reduce the risk of contaminating your field, as moisture that passes through the sterile object draws microorganisms from unsterile surfaces either above or below it. Avoid splashes. Typically, we can see a standard dressing tray in Belize containing stainless steel equipment, usually 2 kidney dishes and a small bowl with some forceps, to be exact, hemostats, either straight or curved, and a small amount of gauze enclosed. Trays with drapes are reserved mainly for operating theater. So if you receive a tray with a drape and decide to use it to expand your sterile field, you still have to remember to maintain principles of asepsis. At times, you may have alternative metals used in the form of sausage tins. We have to adapt based on our local availability and needs. Remember that you have to observe your 1-inch margin of sterility when handling your equipment. This must be maintained as a microorganism-free area. Everything that you put in the field must be sterile. If it has touched the patient or a dirty item, it cannot be replaced in the field. You may put a piece of equipment in one of the available containers, but it should never touch the field. Sterile objects can become unsterile by prolonged exposure to airborne microorganisms. Plan your work. Be efficient at what you do. Fluids flow in the direction of gravity. Please watch the way you hold your tools used for the procedure. Once a forceps is used on a patient, hold it point down. The skin cannot be sterilized. It is unsterile. Once you have come in contact with the skin, microorganisms that normally reside there have contaminated your item or your field where you set that item. For more in this video series, please pay attention to the links in the description section below.